Hello, everyone. My name is Dr. Cece Carter with FreshMed Functional Medicine, and I am joined today with Janelle Solomon. Janelle is with FlowWell Medical Thermography, and she and I met through the Holistic Chamber of Commerce Charleston Metro Division. And today we're going to learn from Janelle what medical thermography is and how it's helpful with our usual healthcare.
Thank you so much, Dr. Cece. I really appreciate you having me on. I always love to pop on any chance I get and just share about how cool thermography is. A lot of people don't know what it is. So if that's you, you're not alone. But I am going to just do a quick little presentation today that will explain it all for you so that you will know by the end of today.
Great.
All righty. So I'll pull up my presentation. I'll share my screen. It says, I can't do that yet. You may have to click something on your side.
Of course.
I know.
Oh, there we go. Okay.
Okay, perfect. All righty. You should see it here.
There we go.
Okay. So you can see everything. Let me just make our little faces smaller. Okay, so what is medical thermography? My name is Janelle Solomon. I am a certified thermography technician, and I'm with BTI, which is Breast Thermography International, and PACT, which is the Academy of Clinical Thermology. And I always mention these companies because we're so proud of our standing with the FDA. We're so proud of just, the quality of care that we give, as well as the standards that we set for our technology in terms of calibration. And so I always mention that because not all thermography companies are created equal, and not all of the equipment is created equal either. So when you work with a technician who is a member of BTI, you're in good hands. All right, so moving on, this is an image of full body thermography. I'm sure you've seen the color palette before. All this patterning. There's also a grayscale imaging as well, which you'll see further in. But thermography, most of the time people hear about us when they want to get their radiation-free breast screening done. And that's amazing. But I do always want to point out that we offer full body imaging as well. We are looking at things like lymphatic congestion, which is extremely important in determining your overall health. If you have any areas of lymphatic congestion, we would work on those areas and actually look for improvement on your follow-up screening. So we're using this as a health analysis tool as well. A specific pattern shows up when we see hormone imbalances, which is really interesting. We're looking for heat or cold over your thyroid and other organs within the torso. We look at the vascular system, the nerve system. Abdominal inflammation is a huge one. If anyone ever has digestive issues or any kind of disease within the digestive system, we can see if there's any inflammation there. And circulation analysis as well. If you have cold fingers and toes and nose, it could mean that your circulation could be improved. So overall, thermography is scanning the body for heat and inflammation. It gives you a heat map. And we're looking to assess all of these specific items. And there's even more that we'll go over later, but just as a start, this is what you will get. And it's not new. So I'll go over the history of thermography. It's actually been around for a really long time. It looked a little different back in the day. So Hippocrates used mud and clay to look for heat on areas that dried the fastest on a patient's body. So that's interesting. We don't use mud or clay today, but that's how it all started. And in 1972, it was deemed beyond experimental. Then in 1982, the thermal imaging device that we use was cleared by the FDA as an adjunctive screening for the following. So we've got the breast cancer screening, thyroid pathology, cerebrovascular screening of the forehead, which I'll go into a little bit later, and then peripheral vascular disorder, neuromuscular conditions as well. So we are assessing all of those different systems with thermography. And a lot of you know that, breast cancer is so common. I'm sure you probably know someone who's been affected if you yourself have not. So we do this screening often to screen for breast health. And I say that because if you do start while you're healthy, that is the best case scenario, so that when anything changes in your temperatures, we catch that immediately, and then you can change the course of your health from there versus, waiting around for something to develop and then you have something, it's too late. So I always want to bring up these statistics because it is very, very common, unfortunately, here. 1 in 8 women will develop breast cancer in their lives. There's 280,000 new cases of invasive breast cancer diagnosed annually, and over 40,000 deaths occur from both men and women annually. And then this one right here is the kicker to me. 80% of breast cancer patients have no family history. And a lot of us believe that it's mostly, genetic, but a lot of times, in fact, 80% of the time, it's environmental or it's lifestyle or it's a combination of those things with genetics or whatever it is that can have a huge influence on your health, which means that you actually have the power and, you can control the state of your health in many cases. Okay, so by 2030, it's estimated there will be 440,000 new cases of breast cancer. So it is rising, and it's also affecting men, 1 in 833 men. And then we have different screening methods here. I'm sure most of you are familiar with the mammogram. It is an X-ray of the breast tissue, and then ultrasound uses high frequency sound waves to produce an image. MRI is magnetic resonance imaging, and then thermography is high resolution infrared photographs of heat patterns in the body. And the reason why I mentioned, the reason why heat is important as it relates to cancer is that 97% of the time cancer is hot. So there are, some very rare cases where perhaps, as an example, say someone had breast cancer, but it was encapsulated by calcium or hiding behind a cyst or something.
Or women have dense breasts and we couldn't really get a clear picture.
Well, so that's the thing with mammograms that I'm actually going into on the next screen, is that mammograms and dense breasts are not great pair. They're not a great pair at all. Thermography, on the other hand, does really great with dense breast tissue. But as you can see here, this is a woman with fatty tissue, no lumps or bumps, no fibrocystic tissue in her breast. This is a dense breast. And the cancer, you can't see the difference between the fibrocystic tissue and the cancer, unfortunately, in a dense breast on a mammogram. So that's really important. This image is like stuck in my head now because that just speaks for itself.
Yeah.
So it just shows that we do need to be screening, multiple ways. So you can layer up and really cover all your bases. Okay, so thermal imaging is a physiological screening versus a mammogram, ultrasound, or MRI. Those are anatomical screenings. Those are searching for a physical lump or bump, and we are looking at the heat in the body. And then there's no radiation, there's no contact between the patient and the equipment or the patient and the technician.
Which is nice for a lot of people.
Yes, I know a lot of my ladies, they are
it's miserable.
Smashed.
Yeah.
Yeah. So there's no, it's just you and I in the room, and we're probably about 6 feet apart, and the camera is just taking the images, and that's as simple as that.
How long does the procedure actually take when you look at these pictures or taking the pictures?
Yeah, so that process takes the actual picture taking only takes about 5 to 10 minutes total. And then the whole process, so we chat about your health history first for a little bit, and then I have you acclimate for 10 minutes. So everyone needs that acclimation period in the room. It's set to 70 degrees, and you have to acclimate in that room before we do the screening so that we can get the same results across the board everywhere. So it's to create consistency there, and also to get rid of some of the heat patterns that your clothing was holding on your body. So we always have that 10-minute acclimation and then the screening. And then I schedule your phone call and take payment at the end. And so you're in and out within half an hour.
Okay.
It's pretty quick.
Yeah.
So this image here is basically just, it's not a great image, to be honest with you. If I saw this, I would probably say there is a concern. So the interpreting doctors would actually mention in the report, they have great concern because of the difference of temperature in the two sides. So the left breast, which is on the right side of the screen there, has a lot of vascularity, whereas the right breast is nice and blue. So this could be a concern for this patient. But ideally, we are using this screening as a health analysis. So, we're taking we do our follow-up. We want to make sure that the temperatures are not increasing over time, but rather staying the same or decreasing.
So could this picture also be somebody who did not acclimate?
No,
No.
because
Okay.
we don't ever take an image without the acclimation process.
Okay.
It's just part of it. So this is definitely vascularity here.
Okay.
It could even be cancer. Yeah. And I will show you a known case below as well. Okay, so here's my favorite part of what I do. I love to monitor health improvements in patients. So you get your baseline, which this was a patient of mine. She came in October 2021. We got her baseline. These are just 2 images out of the full body that she did. And I was telling her, I'd like to see some improvement for next time. I, talked to her about ways that she can implement getting her lymphatic system flowing and just diet, nutrition, all kinds of stuff. And then she came back in April, and this is what we saw. And I was so impressed. She really put in the work, and you could tell a lot of her vascularity has decreased. And you can see lots of blue in the breast tissue there. She still has some work to do, but she has come a long way. And that's what happens when you commit to the work. So it's pretty awesome to see. And then digestive health. This is actually the same patient. So here again, she had inflammation all around the abdomen and not so much over here, which is great. We also do spine and postural evaluation. So check this out.
Oh, wow.
So this patient, there was quite a bit of time in between, but you can tell look at the hips, they were so uneven here, and all the inflammation up in the back and shoulder. And after chiropractic, massage, infrared sauna sessions, acupuncture, all the things that she did to take care of her health, these are the results. Pretty darn cool. And of course, what came with that was reduced pain.
Yeah.
So, all right. So lymphatic congestion is one of the main screenings that we do that's so important. So this is actually an image of a thermography screening with a anatomical overlay here. You can see the lymphatic system. And so when people are super inflamed through the neck region, sometimes into the clavicle, a lot of times we see it in the mouth. We know that most likely it's their lymphatic system that just needs an extra push, and it's part of our immune system. So it is really, really important to take care of our lymphatic system that does not have a pump of its own. So it does need a little bit of help sometimes. And here is an image of oral inflammation that this patient knew she had a tooth infection. She got her thermography screening, and this is the grayscale I was telling you about. It's really easy to see the vascularity or lymphatic congestion or drainage in the grayscale versus the color palette. So as you can see, the health of the mouth is directly correlated to the health of the breast tissue, and it's also very important for the heart health as well. So I always encourage a full body scan for your first time, so we can kind of see if you had anything that you weren't expecting going on with your health like this. And
The
then
grayscale is a little bit creepier, to be
it
honest,
is
but
so creepy. I know. And especially people's faces, they look, like a
yeah,
zombie.
that's where a lot of your lymphatics are. So it makes sense, but it still looks creepy. So
I know. I know. They're not glamour shots.
yes, definitely not.
So this one is melanoma. This patient wanted to do just a breast scan. We had her do a full body as her starting scan, and thankfully we did. She didn't have anything, to the naked eye on her skin. So she had no idea she had this
Wow.
melanoma back here, but it was huge. So thankfully she got
And I
that.
do want to make a quick plug here. So it is May, and May is Screen Cancer Awareness Month. So
Yeah.
this is a great idea to kind of just get yourself evaluated. Even if you go to your dermatological exams annually, obviously they're not going to see this to this extent
Mhm.
just on a skin exam. So this is a great idea to just get people checked out, especially if there is family history or just living in the South like we do.
I
This is a
know.
great tool to use for screening.
Absolutely. Thank you for that. It's a great reminder. Okay, so here is inflammatory breast cancer. This is quite shocking because inflammatory breast cancer increases rapidly,
It's the
um,
worst one. It's
very, very
terrible.
quick. And it's not detected via mammogram because there's no physical lump or bump. It's inflammatory. So it's really important for patients to get a thermography screening in addition to whatever other testing that you're using, because of this and so many other things. So you definitely don't want to see this. This is something that obviously, this patient, she had to deal with. I can't remember if she did conventional or holistic methods. I believe she did conventional. And there's always a time and a place for everything. So
Sure.
this screening is why we do, or this image is why we do this cerebrovascular screening. So the branches of the supraorbital arteries are spread out and they rest on the forehead there, and then they feed down into the carotid. So if we see a massive temperature difference like this on someone's forehead, that is a huge sign that that's not okay. This gentleman did have a stroke 2 weeks later.
Wow.
But this is a very extreme case. Most of my patients, if they did have a temperature difference, it would be, much less than this. I haven't seen anyone with a black forehead at this stage, and I've been doing this for 6 years. So this
So the
gentleman,
darker the color, the worse essentially it is. So obviously
well,
red is
on this part,
pretty. Okay.
so red usually is the hot spot, and that's what you don't want. But for
Okay.
this, you really are looking for the discrepancy between the temperatures. You don't want to see a huge difference in
We don't want a
two.
multicolored face on this one, right?
You don't want black in your forehead because that means, the oxygen isn't getting where it
Okay.
needs to go. Yeah. So we do that screening. Most people are good, but if they ever have, if their temperature is above the threshold for that region, then we have them go do a cerebrovascular, or I'm sorry, a carotid ultrasound to make sure there's no blockage forming.
Okay.
Sometimes when patients go for that, they have caught some, insufficiencies. So it is an important part of the process as well. And then I threw this in here because I love this quote. If you don't make time for your wellness, you'll be forced to make time for your illness. And that is why this, doing preventative screenings or anything, for your health that's going to help you stay healthy.
Mm-hmm.
It's just so important. So throw that in there. And then just so you guys know, we kind of talked about it already, but the process is you schedule your appointment, you fill out your intake forms online. Then you read over your protocols because there's a few things that you want to do prior to your scan to ensure you get the best results. And then you do the acclimation process in the room. We take your imaging. The interpreting doctors will then receive your images and create an entire report for you. They'll do the interpretation process, and then they will get you that report. You'll receive your results, and then you'll have a consultation so that you understand what you're looking at, because it can be a bit overwhelming the first time you see your report. There's a lot of information there. So we'll go through it with you to make sure you understand everything.
Awesome.
And then I go a little bit further and just talk about ways to improve your screening for next time, because that's important to me as well.
So what are some of those steps that people would need to take with this information to then have better results the next time around?
Yeah, so it's things like, referring out. So say they had heat or cold over the thyroid. I know that you're one of the docs in town that I refer to for issues with the thyroid. And so I would say you should reach out to FreshMed, give them their information. They would, then they take it into their own hands. Hopefully they give you a call and work with you to make sure that their thyroid is in good health. Things like that.
Hmm.
Each area of the body. If I need to refer out, I do. And if I can handle it by telling them tips and tricks they can do at home, then I'll give them that information as well.
Yeah, absolutely. So, I mean, you are a holistic practitioner. And so, of course, this is all about practicing those lifestyle factors to improve your wellness, as you've mentioned. So, that can be really helpful in just dictating which areas need more attention than others. And so, I would think that probably includes improving their diet, doing some other stress reduction exercises, not being sedentary if we can help it, things along those lines. Is that right?
Absolutely.
Okay.
Yeah. And it's customized to each person, of course. We just assess the most important, like top three. I don't want to overwhelm anyone because it can be a
Sure.
lot of information, but we just kind of make a list and then they work on it, over time on their own time. So.
And then how often should people come back and get imaging done again?
Yeah, that's a great question. So it's always going to be different for each person after the first time. The interpreting doctors will make that assessment. If they see
Okay.
something of great concern, they may say 3 months, which is rare. Most of the time, it'll come back with a 6-month turnaround request. And that is because they don't want to wait that full 1 year to get your comparative screening done. So once you have your baseline, typically it'll be at about 6 months before I see you again. And then after that, if everything looks good, stable and consistent, it'll be every year, just once a year.
Okay. So
Yeah.
you've kind of mentioned who you do see. So women, obviously, in breast health for sure. But what are
Mhm.
some of the other symptoms or patients that you're looking to help with thermography?
Yeah. So anyone really, there is no one who would be contraindicated for this screening. I would say, you could start as early as a child, but I would say just in order to get your full adult screening, you're 16 to be considered an adult. So I would say, once you hit the puberty process, it would be a good idea to get a baseline then. That way we can monitor changes over time. So, it doesn't matter if you're male or female, it doesn't matter if you're old, young, whatever. It's just a great idea for you to come in and get your baseline as soon as you can.
Great.
Yeah. And then these are the options. There's the breast scan, the health scan, which is the upper body, and then the full body scan. And as I said before, we always recommend either the full body or the health scan at least for your first time. And then after that, you can alternate, do a breast scan next time, and then a health scan, whatever you want to do. But just make sure you're at least checking out the full body on your first time.
Okay.
Take health into your own hands. And I always offer a discount for patients who have taken the time to listen to my presentation and learn. So I have a code. If you wanted to reach out and schedule your screening, then I can give you that code and it's $50 off for you.
Great.
Yeah.
Now, does insurance cover this or is it all cash based?
It's all cash based. Unfortunately, in America, we don't have this screening covered by traditional insurance yet. Other countries include it even in the conventional system. So I'm waiting
Yeah.
for
Yeah.
that to happen.
Unfortunately, we're always a little bit behind on some
Yeah.
things.
Yeah.
Well, this has been very informative, Janelle. Thank you so much. Can you just tell us where people can find more information with your website or a phone number?
Sure. So you can FlowWell.org. It's our website. And then my email is Janelle at FlowWell.org. My phone number, if you want to give me a call, is 803-270-1422. And yeah, I look forward to speaking with you. If you ever have questions, you can email me or call me, and I'm happy to answer them for you.
And do you have a specific place that you are in the Low Country, or are you kind of mobile?
I am mobile. I didn't mention that before, but I travel to several different doctors' offices and practitioners' offices throughout the Southeast. So I'm actually
Oh,
going to be in
great.
Florida this weekend. And then, I go to places like Myrtle Beach or Bluffton. I go to Georgia as well. So, and of course, I have multiple locations here in Charleston for our locals.
Great. Well, again, thank you so much. We've had Janelle Solomon on with us with FlowWell Medical Thermography. You can go to flowwell.org for more information, but thank you so much for joining us and telling us more about what you do.
Thank you for having me. I appreciate your time.
All right.